And as you all know, Dr. Franklin is a professor and is working at the Department of Materia Medica as RVS Homeopathic Medical College, Coimbatore. And he was a regular presenter in our forum, and he has presented so many papers with different methods. He has shown the beauty of homeopathy through his cases also. And he is a person who is strictly following Hahnemannian concepts, and he is practicing for the last 13 years at Coimbatore. And today we'll be discussing about body language. As you all know, the body language is one of the most important aspects as far as a homeopathic doctor is concerned. And the subject is body language, a royal road for homeopathic prescription. Yes, it is a royal road. Let us welcome Professor Franklin Gino to this function. Welcome, sir. You are co-host, sir. You can unmute and speak.
Sir, whether you have been able to hear me now?
Yes, sir.
Okay, sir. Thank you, Danesh, sir, for the wonderful introduction which has been given about me. Thank you all the people who are being present over here for the particular session. And particularly, I thank Manoj sir for giving this opportunity, and Danesh sir and the other co-members who have been there in this particular committee for giving this opportunity to me. So let's go on to the topic. The topic which I am going to discuss today is body language, a royal road for homeopathic prescription. There are so many ways in which homeopathic prescription can be made. So when you are being a good practitioner, when you have been seeing array of patients, that means more than around 100 patients to 200 patients per day, it's impossible that every case can be taken in detail. Every case can be taken in detail, like we can go on with the physical generals, particulars, everything. It's been impossible for anyone source to take all the things in detail. So at that time, it's been there that if you have been having a proper knowledge about body language and the way in which the patient has been presenting, it's been easy for us to come to a particular medicine, and we can come to a conclusion that this may be the medicine which has been given for the patient. We can ask 2 or 3 verifying questions to the patient. The medicine which has been there.
Sound is feeble.
Can you say a little louder, please?
Sir, whether you have been able to hear me now?
Now it is okay.
Okay, sir. Thank you, Danesh sir. Thank you, Manoj sir, for giving the better opportunity for me. The topic which we are going to deal today is body language, a royal road for homeopathic prescription. There are so many ways in which homeopathic prescription can be made. One of the ways in which the homeopathic prescription is being made is based upon body language. So when you have been running a clinic, when you have been seeing more than 100 patients or 200 patients per day, it's been impossible that you'll be able to take the case of any patient in detail. So at that time, it's been must that if you have been having a proper knowledge, especially over there in body language, especially if you have been having a better knowledge over there with the medicines, it's been easy for us to come to a conclusion and we can reach a remedy so fastly. And one of the ways in which the patient can be diagnosed so fastly is body language. There are so many other ways. So even handwriting analysis is being used by some doctors. Even the physical generals of the patient, the disease of the patients, the aversions of the patients, the aggravating factors of the patient itself is been a prime key for making a state of prescription. There are some people who are being prescribing only based upon the astrological point of view. There are some people who have been making their prescription based upon dreams only. So like this, if you have been seeing, there are array of way in which homeopathic prescription can be made. So one of the way in which easy prescription of homeopathic medicine can be made is by using body language. So let's go on with the discussion of body language in detail. So by definition, if you have been seeing body language, it's been a type of communication in which the physical behaviors, not the words, only the physical behaviors are being used to express or it's been used to convey the information. So it's been stated that around 65% of the language which we have been communicating is been there in the form of body language. Only 35% of the words which we have been, or the language which we have been speaking, will be there by means of using words, by means of talking. The people should be conveying the information which is there. So in body language, the prime important things which has been seen is the facial expressions of the patient, the body postures of the patient, the gestures in which the patient has been adapting, the eye movements which the patient has been adapting, touch, use of space has been the prime important core of body language. The study of this particular topic, that means the study of body language, is being called as kinesis. So normally, this particular kinesis is been the science of human understanding. So kinesis means whenever we have been sitting in a particular place, we will be moving our body parts. So the body parts which we have been moving itself marks that we have been making some language by which we have been trying to convey the information which has been there within us. So like that, whenever we have been talking to a person also, it's been there that we will be conveying the information which has been there within us to the other person by means of making some gestures. So this gestures has been the prime important core which has been there in case of body language. And body language, if it has been known properly, means it's been easy that we can make a state of homeopathic prescription so fastly. So normally, body language has been the prime important thing which has been there, having emotions as a prime important core. And emotions and body language is inseparable. And if you have been seeing emotions, the prime important core of emotions are the emotions will be there in the form of happiness. It can be there in the form of depression. It can be there in the form of anxiety. And the milder moods like varying degrees of excitement, drowsiness, arousal, satisfaction of hunger, sex, and other drives will be coming under this there. And the prime important higher part of emotions are happiness, depression, anxiety, and mild mood changes which has been there. So this all things are being reciprocated primely over there in the body language of the patient. The prime important visible codes which has been there in the body languages, the personal appearance of the patient. For example, on seeing onto the appearance of the patient itself, we can make a state of prescription, homeopathic prescription. Like when a sulfur patient has been coming to the clinic, maybe it's been there that he will not be keeping himself clean. Maybe Soranum patient, when he's been coming to the clinic, despite that he's been washing himself, despite that he's been wearing a proper clothing for himself, it's been there that the personal look which has been there in case of this particular personality will be so much altered. So like that, Cali Carbonicum. So when they are been coming to the clinic itself, by their personal appearance itself, we can make out that the person has been obese, the person has been having a state of angular face which has been so larger by its appearance. By that personal appearance itself, we can make a state of prescription. So,
Sir, sir, screen sharing is there?
the second thing which has been there, sir, no sir.
No screen sharing?
No sir, no sir.
No, okay. Okay, okay.
The second thing which is there is the gestures of the patient, the way in which the patient has been sitting, the way in which the patient has been presenting himself tends to be called as the gestures of the patient. So gestures has been the second important, main important code which has been there in the body language. The posture in which the patient has been sitting. So whether the patient has been bending forwards, or whether the patient has been sitting straight, or whether the patient has been having a straight look upon you. So this is being called as posture. Posture also plays a prime role, primely in case of body language. The next thing which has been there over there in case of body language is the facial expressions which is there. The facial expressions which the patient has been making. For example, if the patient has been sad, it's been common that the patient's face will be becoming so much dull, and if you have been seeing the eyes will be going for a state of wrinkling. And at the same time, if the patient has been there under a state of excitement, or if patient has been smiling, or if patient has been there in a will be showing a state of happiness, and by which also we can make a state of prescription. And if you have been seeing the medicines like phosphorus, if you have been seeing the medicines like lacasis, the facial expressions of these people tends to be so much bright, and the brightness of the face itself makes a state of prescription, especially in case of body language. And apart from that, if you have been seeing the medicines like ignatia, if you have been seeing medicines like natrium, if you are seeing medicines like magnesium carbonicum, so all these medicines will, on their seeing onto their face itself, you'll be able to feel a state of sadness in them. And the sadness itself, the sadness as a symptom itself will be leading towards a state of a particular prescription. And this could be the brain thing which has been there concerned over there in case of body language. And the eye expressions of the patient, like when the patient has been sitting in front of you, whether the patient has been crying, or whether the patient has been sighing, or whether the patient has been brilliant by his outlook. So all these things will be giving a state of main outlook for making a state of homeopathic prescription. And when the patient has been coming to the clinic, whether he has been sitting in front of you, or whether he's been taking the chair and he's been taking the chair maybe miles upon you, miles apart from you, or the patient has been taking the chair and he's been moving and he's been sitting maybe around 3 or 4 feet away from you, it itself makes that the patient has been not comfortable with you. That itself gives a state of idea that a prescription which has been based upon the distancing or the space maintenance should be made. For example, if a tuberculin child has been coming to your clinic, or if a phosphorus child has been coming to your clinic, the child will come directly, the child will sit in your lap, the child will play with you, the child will be talking with you so much. At the same time, if you have been seeing the tuberculin child will take something, it will play with a particular thing, it will. So that is the character which is there in case of tuberculinum. Tarantula hispanica also has been a child who's been having a state of hyperactivity. That particular child also will come with you. They will talk with you so nicely. At the same time, phosphorus, if it has been coming, they will talk with you. So the way in which the child has been talking itself gives a clue that, wow, what a wonderful child it is. How the child has been responding. So this all things will be making a state of proper. We can make a state of homeopathic prescription. Then the prime important thing is voice and intonation. That means the way in which the patient has been pronouncing his voice. For example, if a pulsatilla child has been coming to the clinic, the child will be talking over there in a milder manner. If a lycopodium personality has been coming to your clinic, the lycopodium personality will be talking with so much of arrogancy. And if your sulfur has been coming to the clinic, the sulfur will be also talking with so much of arrogancy. So the voice and the usage of voice which the patient has been making itself will make a state of proper homeopathic prescription. And tactile communication in the sense when the patient has been coming and sitting in front of you, whether he's been touching his body parts or whether he's been touching your body. So the way in which he's been touching the body, the way in which he's been adapting a posture in touching his own body itself will give you a clue that a particular prescription, which is based upon the particular way in which the patient has been responding, should be made. First, we can go on with the personal appearance. So in the personal appearance, there are mainly 6 important components which is there. The first component which is there is the clothing of the patient. So when a patient has been coming to you, it's been must that you have to see onto the clothing of the patient. It also gives a state of diagnosing the particular case. Like for example, if a patient has been having a state of psychiatric complaint, he's been not coming with a proper clothing. That itself gives a clue that maybe the patient has been schizophrenic, or the patient has been maniac, or patient has been having a state of depression or something like that. Apart from that, it has been also having its main important role primarily in case of homeopathic prescription also. For example, if the patient has been wearing a proper clothing, and when he has been ironing his clothes properly, and when he has been coming to the clinic itself, his presentation has been wow means, it's there that we'll be going on directly with the prescription called as arsenic amalgam. So like this, the way in which the patient has been presenting, the clothes in which the patient has been wearing. For example, if a initial lady has been coming to the clinic, when he's been coming to the clinic itself, the mode of the color of the cloth which she's been wearing itself gives a state of gives a state of idea that maybe the Ignitia lady, when she has been coming to the clinic, she'll be coming with darkened clothes, like even the blouses or whatever dresses which she's been wearing will be usually black and white by its appearance. And like that natrium muriaticum lady, when he's been coming to the clinic itself, that itself he will be giving a clue that patient has been having a state of depression. So normally darkness or blackness points that patient has been having complaints of depression. That itself makes a state of prescription on seeing onto the patient itself. And apart from that, there are so many medicines which is there. So on seeing onto the appearance of the dress, the way in which they have been wearing the dress, everything makes a state of proper homeopathic prescription. For example, Cali carbonicum, if you have been seeing, Cali carbonicum, when they have been coming to the clinic, they will be coming with old-fashioned clothes. And the old-fashioned clothes itself makes a state of prescription that maybe the patient has been having a state of old thoughts, which has been they are incited in her mind almost all the time. So because of which, if you have been seeing such peoples, we will be going on with. And if a patient has been coming with clothes which has been fabulent or which has been so much bright by its appearance, the medication which should be thought of is, for example, phosphorus. When it has been coming, they'll be wearing so much of fabulent or the clothes which has been attracting the other people so fastly, like red colored clothes, or if you're seeing Tarantula has Hispanica, when he's been coming to the clinic, they'll be wearing clothes which has been having different colors. And based upon the appearance of the clothes itself, we can make a state of prescription when a patient has been coming to you. And footwear marks the prime important thing when a patient has been coming to the prescription. For example, if you have been seeing a patient for the first time, it's not that we'll be seeing onto the face of the patient directly. The prime thing which we'll be footwear of the patient only. So the footwear has been kept clean means it's been there that the person has been perfect and the person has been good. Despite that, if he's been wearing good clothes also, if he's been not maintaining his proper footwear means it marks the patient has been imperfect by its appearance. And if he has been keeping the shoes to be so clean, if he has been daily he has been putting a state of this one, and if he has been maintaining a proper footwear means it's there that mark that it's been none other than arsenic amalgam which has been wearing his footwear properly. And hairstyle also marks the patient that this particular prescription should be made for a person with a particular hairstyle. Like for example, if a pulse settler is coming, they'll be having a sandy type of hair, and the hairs. And when we have been seeing onto the appearance of the hairs, like it will be short and it will be brightening by its appearance. So by that itself, we can make a state of prescription. So hairstyle also makes a prime role, primarily over there in case of homeopathic prescription. So this all things will be primarily coming under a state of personal appearance. Then comes the ornaments which the patient has been using. For example, if it has been natrium muriaticum doesn't like to wear any sort of ornaments at all. But at the same time, if you have been seeing Platina, when he has been coming to the clinic itself, she'll be wearing so many ornaments. So she want to show off herself, and by that she'll be coming to the clinic. So that itself makes a clue that it's been a personality called as Platina, and we can go on with the prescription based upon the ornaments which the patient has been wearing. Then the makeup of the patient also makes a prime role, primely over there in case of prescription. The patient has been making up himself so much, like he's been spending so much of money over there in the makeup. One of the main remedy which should be thought of is lacasis. The second remedy which should be thought of is ignitia, and the third remedy which should be thought of is medorina. So the people who have been spending so much of money mainly for makeup will be coming under this particular group of medicines. Then comes aromas, the smell which has been emanating from the patient itself gives a clue that maybe this patient has been coming under this particular medicine. For example, he's been sitting in front of you, despite that he has been keeping himself clean also. A sore nature will be coming, sore odor will be coming from his body. Baptisia patient, when he's been coming to the clinic, cadaverous odorous smell will be coming from his body. And like that, if you have been seeing arsenicum album when he's coming to the clinic, despite that his body, everything has been kept clean and perfect. The discharges which is so much offensive, but at the same time, some patients have been there, like a lacasis patient who has been coming to your clinic, or the ignitia patient who has been coming to the clinic. They will do so much of makeup, they will put so much of spray, and they will be having a state of good aroma when they are coming to the clinic. So that itself gives a clue for a proper homeopathic prescription. The gestures which the patient has been adapting when he's been sitting in front of you also gives a proper important role in case of homeopathic prescription. So when you have been reading gestures, the gestures which the patient has been making should be read in clusters. It's not that we have to see onto only one gestures which has been made with the patient, and we cannot come to a conclusion that the patient has been so much reserved, or the patient has been critical by his thinking, or whether the patient has been open by his nature or not. So the prime things which has been there is, for example, the gestures which has been made by the patient should be taken in detail. Not only one gesture, at least 3 to 4 gestures should be taken together so as for making a state of homeopathic prescription. For example, if a patient has been coming and sitting in front of you, and if you have been taking a rubric like the patient has been having critical thinking, so the prime gestures which should be there together are hand to face gesture should be there, should be pointing upon to the cheek when the patient has been talking, and the legs which has been the leg posture which the patient has been maintaining should be crossing each other, and the chin of the patient should be also looking down. So this all gives a clue that the patient has been critically thinking about the things which we have been telling. So like that, look for concurrence which has been there. So whatever which the patient has been talking, the patient has been talking properly. At the same time, he is not making a proper body language according to the way in which he has been talking. That itself gives a clue that the patient has been making a incoherent talk. For example, if a politician has been standing over there in the public and he's been telling that I am there for helping all people, I am there for giving whatever things which has been there with me to you all for you all people. But at the same time, if the particular person has been adapting a posture like the arms are being folded, the legs are being tightened, and the chins are being down, means that itself gives a clue that the person has been not speaking from his heart. The person has been highly reserved person. The person has been not ready to do anything for you. So when a gesture has been seen, the gesture should be seen according to the concurrence. The first thing what we have discussed is the gesture should be seen over there in clusters. The second thing which we have seen is the gesture should be seen over there in concurrence. The gesture which the patient has been adapting should be there which is matching to the context which is there. For example, if a patient has been sitting over there in the bus stand with the arms and legs tightly crossed and the chin down, the cold weather means it's not that we can't take the particular rubric like defensive or something like that. So as the particular climate has been so cold by nature, the patient has adapted such a posture. So in such cases, the gestures should not be taken climatic changes which has been there. And like that, depending upon the areas, some patients can adapt some different sort of postures. So such postures should not be taken for homeopathic way of prescription. The same person has been sitting in front of you. If he has been crossing the legs, if the chin has been down, he's been not looking upon you properly, means it marks that patient has been highly reserved by its nature. That's the reason for the adaptation of the particular gesture. We can take the direct rubric like the person has been so much reserved by his nature. Then comes the posture of the person which he's been adapting. So when the patient has been coming in front of you, sitting in front of you, the way in which the patient has been sitting, whether the patient has been sitting straight, whether the patient has been kneeling down, or whether the patient has been sitting in the back, whether the patient has been adapting a posture like he's been trying to take two more seats also on the both the sides. So that itself gives the clue that the patient has been hearty or the patient has been having a state of what to say, the patient has been bold and patient has been so courageous by its nature. For example, the medicines like Naxomica, Lycopodium, such medicines will be coming when patient has been coming with such a posture. So patient will try to engulf or the patient will try to take two more seats when they are been sitting over there in the clinic. So the posture itself will be marking as a prime clue, primely over there in case of homeopathic prescription. And the sitting postures, if patient has been crossing the legs when patient has been coming and sitting in front of you, it's there that the patient has been not bothering about whatever this, which you have been telling to the patient. So we can, the patient has been not ready to apologize for whatever things which you have been telling, which you have been asking to the patient. So such people should be asked, making a state of cross ankle posture, and the way in which the patient has been sitting itself makes a proper homeopathic prescription. The patient has been putting his hands over there in the pockets when he has been coming inside the clinic because of the fear which he has been having on seeing onto the physician. Maybe the medicine which has been coming under the particular body language can be arsenum nitricum, arsenicum album, and the nervous remedies will be primarily coming under the particular group of peoples who have been having a habit of putting their hands inside the pocket when they have been coming inside the clinic. The facial expression which the patient has been making itself gives a state of proper homeopathic prescription. So if a patient has been coming in front of you, it's there that when patient has been smiling in front of you, it marks that patient has been having a state of friendly attitude. And if patient has been frowning when he has been seeing unto you, that itself marks that patient has been discontented with what we have been telling. The patient has been having a habit of raising his eyebrows when he's been talking, means it marks that patient has been having disbelief in the things which we have been telling. The patient has been tightening the jaws when he's been talking, means that marks the patient has been having antagonism. The patient has been not ready to agree to whatever thing which we have been telling. So by which itself we can make a state of homeopathic prescription. The patient has been having a state of fear. The mouth corners will be stretched backwards. The eyelids will be open. The eyebrows will be up and it will be together. And if patient has been having a state of happiness, both the lip corners will be pulled up and towards the ears. If patient has been having disgust to what we have been telling, the upper lips will be pulled up, but at the same time, the nose will be going for a state of wrinkling. The brows, the eyebrows, patient has been in a state of anger means the lips will be narrow, the red part will be rolled in tight, and the lower and upper eye will be down. Patient has been adapting a state of blank face when he has been sitting in front of you means the person has been unfriendly by his nature. Patient has been stroking the chin when he has been sitting in front of you means it marks that patient has been thinking so much. Patient has been having hand over the mouth means it's there that the patient has been disagreeing with what we have been telling. Patient has been having a habit of scratching the nose often when he's been telling his complaints means the patient has been lying. Patient the face, if it has been rested on the hand, means it has been marking that patient has been boredom. The facial haunting movements means it marks that patient has been not agreeing to whatever things which he has been speaking. So like this, if you have been seeing eye contact should be also given so much of importance. And if patient has been making a proper eye contact, it marks that patient has been ready to hear whatever which you have been speaking. And if patient has been putting on his eyes down when you have been talking, means that itself marks that some remedies like Natrium muriaticum, Ignitia, Staphylococcus aureus, Magnesium carbonicum, such group of medicines will be coming under the peoples who have been having a poor eye contact. But at the same time, if you have been seeing phosphorus eye contact, the phosphorus will be having a good eye contact with you. They will talk with you so nicely. Lachesis will be having a good eye contact with you. Where Lycopodium, despite that they have been having a state of anxiety, they will show that they have been not having any sort of anxiety by showing a state of eye contact. And if the patient has been not having a eye contact properly with you for a continuous period of time, that marks that patient has been not having, the person has been not having a proper, uh, the person has been lying from his core and the person has been not telling the truth. So we can take the direct rubrics like lying when the patient has been expressing such a symptom. Space and distancing. When a patient has been coming to your clinic, when they have been coming, sitting near to you, that itself marks that patient has been so much close with you, or the patient has been having a good, will be having a good rapport with you. If a person has been a puffy and egoistic person, the person he will occupy more space by extending his arms. So, patient has been so shy by his appearance, he will be so reserved to a particular place only. He will keep his hands like this, and he will sit like he or she has been so shy by her appearance. So the shy remedies like Pulsatilla, Silesia, so such group of medicines which has been having a state of shyness can be directly taken for them, and prescription can be made based upon that. So normally, if it's there that we will be having an intimate zone with some people's like parents, spouse, children's, close friends, relatives, and pets. But at the same time, the personal zone of around more than 8 inches has been 8 inches to 48 inches has been adapted for social functions. The social zone which has been maintained has been around 4 to 12 feet. With the strangers, we'll be having a distance zone, and in the public zone, when people are being large in their number, at least 12 feet of distance has been maintained by us. And lastly comes tactile communication. Tactile communication means it's the power of non-verbal communication in which the patient has been touching the body part and he's been showing that his own body parts are the other person's body part, and he's been trying to uh, convey the information that what he's been having. Touching to self has been the commonest posture by which we'll be getting over there in the clinic. For example, the patient has been coming over there in the clinic. He has been scratching his neck often means it's there that patient has been doubtful about what we have been talking. The person has been irresolute about what we have been talking with the patient. The patient has been pulling his collars often, like this. It, it marks that patient has been lying to whatever which you have been asking. Patient has been pinching the nose often means, or if patient has been bridging the nose with his closed eye means, it marks that patient has been negatively evaluating about yourself. Then tapping the nose often means it has been marking that patient has been having a state of resentment. If patient has been putting his fingers inside the ear, means it marks that patient has been condemned to what you have been talking. If patient has been pulling the ears often when you have been when he has been talking to you, means the patient has been indecisive by his nature. And if patient has been trying to wrap himself when he's been talking in front of you, means it marks that patient has been withdrawing himself almost all the time. When a patient has been biting the nails when he's been talking to you, means it marks the patient has been having a state of nervousness, or the patient has been having anxiety. The rubric directly called as anxiety can be taken. The group of medicines which has been coming under anxiety can be given for the particular patient. So raised steppy when head is been tilted backwards. So if the patient has been coming and if he's been sitting like this and his head has been tilting backward, means it marks the patient has been having a state of arrogance. So the rubric called as arrogance can be directly taken. The medicines like calicarbonicum, sulfur, lycopodium. So that group of medicines which has been having a state of arrogance nature can be taken directly. Lowered steppy means if patient has been sitting like this, moving his head forward means the patient has been submissive by his nature. Patient has been coming in front of you, sitting, and if he's been pulling the hair or he's been twisting the hair, means it marks that patient has been there in a state of fantasy, and the patient has been daydreaming by his nature. So the direct rubric called as fantasy. Rubbing the palms when the patient has been talking to you means it marks the patient has been having a state of anticipation. Rubbing the eyes often means it marks the patient has been having some doubts in what we have been talking. Fondling hair often means it marks the patient has been lacking confidence in himself. Eye lid pulling, if it is there, means patient has been having a state of boredom nature. So like this, on seeing onto the nature in which the patient has been adapting his gestures, we can make a state of prescription. If patient has been lifting the eyebrows, means it marks the patient has been having disbelief, or the patient has been having shock, or the person has been under a state of surprise. If the patient has been having a habit of putting his finger, means you can take the direct rubric called as assaulting the other person or attacking. So such rubrics can be directly taken. If patient has been having a habit of enlarging the eyebrows for whatever which you have been speaking, means the patient has been under a state of astonishment almost all the time. If patient has been having a habit of rubbing the nose often, means the person, the rubrics like lying can be taken. Or if patient does want to talk something and patient want to think so much when he is been speaking, so that could be the reasons by which he will be rubbing the nose. If patient has been coming in front of you, he's been having a habit of tapping the fingers, means the person has been impatient by his nature. So the direct rubric called as impatient can be taken. Shunking the shoulder when the patient has been sitting means the patient has been ready to hear to what you have been telling. Patient has been patient's body has been there on a state of motion almost all the time when the patient has been sitting in front of you, means the direct rubrics like restlessness, nervousness can be taken. Or if patient has been having a habit of shaking the legs when he has been talking with you, means it's there that mark that patient has been under a state of stress. And the rubric like stress can be directly taken, and prescription which has been based upon the So the lying activity which has been done by the patient is often when he has been talking, putting a hand over the mouth almost all the time, pulling on the ears, scratching the nose, and casting the eyes downwards. And usually when he's been talking to you, he'll not be talking, his eyes will not be looking upon you, it will be looking onto the left jaw. So such posture, if it has been adapted by a patient, means a person, means it marks that patient has been lying, and the direct rubric called as lying can be directly taken for homeopathic prescription. Then if patient has been uh, rejecting to whatever thing which you have been telling, means our patient has been having a habit of rejecting, our patient has been having a habit of not listening to what you have been telling, means the person will be crossing his arms and legs when he has been coming and talking to you. And a patient has been uh, putting his hand upon the hips, means the patient has been defensive by his nature. A patient has been having so much of anxiety, means they'll be having a habit of massaging the temples almost all the time, hunching the shoulders almost all the time. And when a patient has been talking with so much of truth, means whenever he's been talking, he'll be talking with open hands. And usually eye to eye contact will be more there in case of a person who's been talking whatever truth from his inner core. Patient has been having an aggressive nature, means the person will lean forwards, and the patient has been clenching his fist almost all the time, means it's been there that we can take the direct rubric called as aggression, and we can make a prescription based upon the particular rubric which has been there. So let's go on with some remedies which has been there, where we can make a homeopathic prescription based upon the body language which the patient has been making. For example, we can first take a remedy called as lachesis. So lachesis, as we all know, will be having a main important symptom called as suspiciousness. So as the patient has been having a state of suspiciousness, the person, when he is been coming and sitting in front of you, they will not be having a proper eye contact with you. Usually the eyes will be glancing sideways, and they'll be having a habit of touching the nose often. Patient has been, as the lachesis patient has been dictatorial by his nature. When he is been sitting in front of you only, the person will be adapting a posture which has been erect by its nature, and he will not be leaning himself forwards, and he will not be sitting in front of you, and he will give you a state of proud, arrogant attitude when he is sitting in front of you. And anger has been one of the prime important character which has been seen over there in case of lachesis. So normally when lachesis patient has been speaking to you, they'll be pointing out the fingers and they'll be speaking to you. And they'll be having a dilated pupils, and the voice of lachesis peoples will be so much loud and it will be bouncing by its nature. So they have been also sarcastic by their nature, and as they have been sarcastic by their nature, on seeing onto the mouth movements itself, we can mark that patient will be having a state of smiling. And when the patient has been smiling, the corners of the mouth will be going for a state of moving to the sideways, and that itself marks that patient has been sarcastic by his nature. And patient has been having a loquacity attitude in case of lachesis, that it's been marked by the way in which the patient has been speaking, and the patient will be jumping from one point to other points, and the point which he has been running from one point to other point will not be having a proper tail or head when he has been speaking. So let's go on with the second remedy called as Lycopodium clavatum. So confidence is the prime thing which has been lacking primarily over there in case of lycopodium. That has been one of the prime important core symptoms which is there in case of lycopodium. Eye to eye contact has been less over there in case of lycopodium peoples. So the fingers will be commonly kept upon the mouth, which marks that patient has been not having a state of confidence in himself. And when they are been giving a handshake to you, the fingertip grab type of handshake will be given to the physician. The person has been usually haughty by his nature. As the patient has been haughty by the nature, normally the patient's eyebrows has been raised and the head will be tilted backwards. And normally the patients have been boosting by their nature. As when we have been seeing under the patient, the hands will be behind the head and they will be having a swagger walk when the patient has been coming to the clinic. And lice inclination to tell has been also one of the common symptoms which is there in case of lycopodium, where it's been marked like the patient will be having a habit of touching his nose often with the hands, especially upon the end of the sentence. When he's been talking, at the end of the sentence, he'll be putting on the hands framed upon the mouth. That itself marks the patient has been lying when he's been speaking. So let's come to the end of the particular session. So it's been time for us, I think. So once again, I thank all the members, whomever who has attended this particular session. Thank you all once again. Thank you, sir. Thank you, Danesh sir. Thank you, Manoj sir. Thank you all once again.
It's really a magnificent session from Professor Franklin Gino, and you have covered almost all part of the observatory skill required for a person to find out the right remedy from the very observation of the patient. That's what you have shown in this session, and why the actions and reactions and even the things that are shown by or that we call as gestures are very important in choosing the right remedy. And in the meantime, also how the patient communicate with the doctor as well as the first people around him is also very, very important. And that is what you are telling about in this session, and what kind of rubric one need to choose at the symptoms, or what are the things that are shown by the patient in front of the doctor in the clinic. And these are all points narrated in a beautiful way. Thank you for your excellent session. Hope we can have a short time for discussion for 10 minutes. Dr. Hariharan sir is there always to begin with. And so begin, sir.
And Dr. Franklin, see, your session is very good. I am appreciating that. But
Okay.
I like to say one thing is that, see, make a video upon this subject, and you can see that, and it will do good for the homeopathic doctors. Can you hear?
Sir.
Can you hear me, doctor?
Yes, sir. I'm able to hear you, sir. Surely I'll be making a video. So one or other day, I'll be making the particular presentation to you itself. And like in this particular group itself, I'll be making a video, and I will be sending it, sir.
Yeah. So please do that. See, now another thing is, it is a branch in homeopathy. It is a branch in homeopathy prescription.
Sure, sir. Sure, sir.
It is a branch. Like we see the constitutions, we find out it will addition to the constitutional medicine, say this type of gestures. Suppose a liver patient comes and see rubbing at the region of the liver, that is, some patient will do that. See, likewise, a lot of gestures are in homeopathic materia medica. So it is a fine subject. I am congratulating you. So please come with a video and show us, and we will be very grateful to you if you come with like that. Okay,
Sure.
thank you very much.
Even I've been having some cases with me, but I'm not able to put it up in this particular time. As the time has been, as we have been running out of time, I'm not able to put the particular cases which has been there. So surely in one or other session, I'll be putting the particular cases also, sir.
Okay, thank you, sir. Thank you, sir.
Thank you so much, sir.
we can do another session with the case presentation and the coming edition of presentation in January, and we can
Yes,
find
sir, sure, sir.
one day
Yes,
also.
sir.
I invite Dr. Bob Lim for his comments. Dr. Bob Lim from Malaysia. Please unmute yourself. Dr. Bob Lim, please unmute. If anyone want to have a chat with Professor Franklin, you may please raise your hand so that we can allow you to speak. I think there is no response coming out. Dr. Thomas Varghese, or do you want to speak? If anybody have any doubt, you can ask to directly. You can ask to Professor Franklin. Anyway, it's a very nice to have. It's very nice to have such a wonderful session in this evening, and we have really have a very good dinner with homeopathic prescription, and that too in a different way. And why a person need to look into the patient, and what are the things to be observed. Usually, people always go to the symptoms rather than see. It is better to concentrate on the patient rather than simply going to the symptoms or the name of the disease. That's why most of the brilliant doctors even both Dr. Prakasham from Kerala, as you all know, that he is a legend who was practicing at Calicut. He's never look at the prescription given by some other doctors, or he's never look for these diagnostic thing, but instead he directly prescribe what he saw in front of him, and that really works in a very good way, very fast way, because his knowledge in materia medica as well as his observatory skill. Most of the doctors who have studied in Calcutta have such a vast knowledge in this observation skill, but in those days the professors were giving that kind of teaching. But nowadays things are entirely different, and that may be the reason why people always go for the patient's symptom, right side symptom, left side symptom, and aggravate by cold or hot like that. But the more important thing is the patient himself. Anyway, we are very happy to say congratulate you, Professor Franklin Gino, for your excellent presentation in this evening. Once again, we are thankful. I'm thanking you on behalf of International for promoting homeopathy, as well as on my behalf for this auspicious day. Thank you, Dr. Franklin.
Thank you, sir. Thank you so much, sir.
Tomorrow we will have a session from another doctor from Calcutta, and that also is an important session with the relevance of ECG and how one can diagnose each and every case with the ECG report, and that will be discussed by tomorrow. Abhijit Srivastava Chaudhary will be the person who is presenting tomorrow. Thank you, doctor. Thank you all. And it is over to Dr. P. Shaila to moderate the Malayalam session.
Thank you, Dr. Dhanesh. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ വെബ് പരമ്പരയുടെ 1203 ദിവസമാണ്. ഇന്ന് ഈ പ്ലാറ്റ്ഫോമിൽ മലയാളം സെഷനിൽ പൊതുജനാരോഗ്യ ബില്ലിന്റെ ശരി തെറ്റ് എന്നുള്ള വിഷയത്തിൽ ചർച്ച തന്നെയാണ്. 2-3 ദിവസമായി ഈ പൊതുജനാരോഗ്യ ബില്ലിനെ കുറിച്ചുള്ള ചർച്ചയായിരുന്നു. അതിന്റെ ഓരോ ഭാഗവും വായിച്ച് അതിന്റെ എന്താണ് അതിന്റെ ഉള്ളടക്കം ഒന്ന് മനസ്സിലാക്കി തരികയും അതിലെല്ലാവരുടെയും അഭിപ്രായങ്ങൾ സ്വരൂപിച്ച് നമ്മുടെ ആ ഒരു നയം തയ്യാറാക്കുകയും ചെയ്യുന്ന ഒരു